like to ask you is that where do we go to? Because I've heard Brazilian butt lifts, which you're doing
Yeah,
so
yeah,
many these days. It's kind of banned in the UK and so many places because of the dangerous outcomes. So tell me, doctor, whom do we go to? Whom do we trust?
that's an interesting question. So I'd like to first answer the question on Brazilian butt lift. So
Yeah.
the rates of the incidence of deaths after a Brazilian butt lift used to be 1 in 2,500, which is massive. And they were dying because the fat was being injected in the muscle or under the muscle. So in the butts, you have the skin,
Okay.
you have the fat, the
Okay.
fat pad where we sit on.
Right.
Then you have the muscle layer, and then you have the bone, the hip bone.
Okay.
Now, what happened was surgeons started injecting. They did not know which plane to inject, which layer to inject in. So some of them started injecting randomly in the fatty layer, or even in the fatty layer is great, but they started injecting in the muscle or under the muscle to give like a massive butt appearance. Now the problem is there are major blood vessels which are running under the muscle, so this fat would go into the veins, would cause clotting in the lungs, which is called pulmonary embolism, and this would lead to people dying.